You're nice and numb, so we're going to try the stent in. And the stent is looking pretty solid.
Rian, we've seen you try in the stent there. What is the purpose of the stent?
The stent is one of the most important parts of the procedure. This was patented by Dr. Shatkin, and you really need that to put the implants in the right position.
So the pilot hole gets drilled through the stent?
Yes. To put the implant in to 15, and we'll do it right down, which is very easy. That's it.
We've seen you adjust the speed of the motor there. What different speeds do you use, and how critical is it to actually use the right speeds for the different parts of the procedure?
Very important. When we do the pinhole initially, we do it at 500 revs RPM, and when we do the seating, like what I'm doing now with a slow handpiece, we go down to 15 RPM.
So the implant's actually placed in the mouth utilizing the drill?
Definitely, and it's coming out of a sterile packet into the handpiece, into the mouth.
And there it looks like a ratchet that you're using to tighten the implant there. Please tell us about that.
That is actually a mini torque wrench, and we use that to place the implant at the right tension, right to the gum line.
So that's used for the final placement of the implant?
Definitely, because you can't do it with a handpiece. You have to do it like that.
There it seems like you're trying the bridge in, is that right?
That's absolutely right.
So you're checking whether, what are you checking for when you try it in?
That the bridge go in all the way, that it doesn't rock, and that the bite or the occlusion is perfect. There I'm using the bite or articulation paper.
Rian, this looks like a very, very complicated procedure. How many years have you been doing this, and how many courses did you have to attend to develop this skill?
I've been 3 months ago in America to attend the American Dental Association meeting. I did a mini course, went back to America for a one-day course, and this is the second case that I've done in the 2 weeks that I'm back.
So, in other words, you're saying that you only attended one lecture and you can actually do such a complicated procedure?
It is not complicated at all. It's as easy as doing a filling. All you have to do is follow Dr. Shatkin's procedure, and you can't make a mistake.
That bridge has now been cemented in permanently, and what are you doing there now?
I'm just taking the final X-ray to explain to the patient and have it for our records. Was it painful?
No, it wasn't painful at all.
You didn't feel anything during the 4 implants that we put in?
No,
Not
nothing
at
at all.
That's wonderful. And would you recommend it to any other people as an immediate loading procedure?
Oh, I would recommend it to anybody. It was probably easier than getting a filling.
That's fantastic. Now, I just wanted to get your opinion. So I promise you, Dr. Shatkin said, I can take you out for a nice steak now, and I'm going to do that right now.
Okay.
And a big glass of wine.
Yeah, a steak and a glass of wine. Thank you.
And this is the panoramic X-ray we've taken, and that was sent off to Dr. Todd Shatkin's laboratory in America. Here you can see where the implants was marked, and now I'm going to put the little periapical X-ray, which we've taken just now. What we can see there is your eye tooth. This is your first implant, that's your second implant, the third one, and the fourth one.
Yep.
Okay.
Okay, thank you.